This has been a success story for us because since June 2010, so not even 4 months ago, there were already 1,000 participants that registered to the course. And we know that remote and isolated communities sometimes have issues with connectivity with the internet. So we actually have printed CD-ROMs, copies of the course, which are here at the front if you want one to take back home. And we've been requested to send out 500 of those CDs in less than 4 months across Canada. So to us, that means people are interested and are hearing about it. So that's good. Another way to measure the success for us was that all the participants were pre-surveyed on their knowledge of the HPV issue regarding Aboriginal clients particularly. And upon the completion of the program, participants scored 29% higher on their post-test than on their previous test. So there's a retention of knowledge there. That's good for us. And there's also a post-reflective activity for the HPV course, which asks participants to suggest strategies that would recommend to improve education about HPV infection amongst the Aboriginal population. So this is where people kind of want to share their best practices. And a registered nurse from Ontario suggested something like, you should have more outreach program, engage community leaders, train volunteers from the Aboriginal communities to provide informal education sessions. So the feedback that we are receiving and the discussions that are happening between healthcare professionals is tremendous in helping us get the ball rolling to something that would be relevant for us to use in later years. More success to come. In completing a course evaluation, the overwhelming majority of learners found the program to be relevant to their practice, current and up to date, and the topic is one of interest and relevancy. So again, we're happy to hear that people are responding very positively around this course. And when we asked to identify changes participants would make to their practice as a result of doing the program, 52% of respondents were able to identify new ways that they could improve their counseling skill and knowledge base. And that's only 4 months of course online. So based on these types of discussions that are coming through, we will be continuing to monitor that and see where it leads, and maybe we'll get some new leeway as to where we should go next. And hopefully we'll be able to do some similar things next year, build on this course, or integrate some of it with others and pass the word along that this is actually working really well based on what we've received. Thank you. That's it from me.
Thank you, Martine. I also think it's worth mentioning, it's really great to hear that Dr. Don Wilson was involved in that project, as he is one of our Aboriginal physicians. Yep. So our last presenter will be Stephanie Totten, who is a senior epidemiologist in the Centre for Communicable Diseases and Infection Control at the Public Health Agency of Canada. Her work focuses on sexually transmitted infections and hepatitis C surveillance. She has a master's in science in community health and epidemiology from Queen's University and a Bachelor of Science in biomedical sciences from the University of Guelph. Welcome, Stephanie.
Good afternoon. And just before getting started, I'd like to acknowledge the Algonquin peoples for hosting us here on their territory today. So my name is Stephanie Totten, and I'm presenting on behalf of the Planning Committee for a symposium that was held this summer called Enhancing HPV Prevention Among Indigenous Populations, International Perspectives on Health and Well-Being, and I'm presenting the results of a literature scan that was done in preparation for this. So, before getting started, I'd like to acknowledge that I'm presenting the work of other people today. Olivia Reams, who had worked with us for some time in the center, she did the majority of the research and writing on this literature scan under the mentorship of Dr. Alan Ronald from the International Center for Infectious Disease, Dr. Eric Cleaver from Cancer Care Manitoba, and Ms. Catherine Dinner from the Public Health Agency of Canada. And other members of the Planning Committee, including members from the National Aboriginal Health Organization, provided valuable feedback and input as well. So the purpose of the literature scan was to determine the burden of human papillomavirus, or HPV, and its health-related consequences among Indigenous peoples worldwide. while the scan contained international data from countries such as the United States, Australia, New Zealand, and some South American countries, as well as Canada. My presentation will focus on results that came up from the First Nations, Inuit, and Métis peoples in Canada. So this slide is just to show that of over 300 million Indigenous people in over the worldwide, it's estimated that there are about 3 million in the U.S. and Canada. And just a little bit more background on the literature scan. So the symposium, Enhancing HPV Prevention Among Indigenous Populations, this was held in Montreal this past July as a part of the International Papillomavirus Conference. And this was the first time in the conference's 26-year history that a part of the agenda was dedicated specifically to Indigenous health. So it was a very important initiative that was pulled together. The objective of the symposium was to share current information on the burden of HPV-related diseases and to identify promising interventions and wise practices among Indigenous populations internationally. And so the purpose of the scan itself was to actually provide a little bit of a backgrounder and some information to see what do we know about these issues in Indigenous populations before embarking on the actual symposium. So a variety of information sources were consulted for the scan, including peer-reviewed literature and reports that were identified through library databases, agency websites, and other sources. There was information regarding cervical cancer screening or Pap testing, and HPV infection. However, information on anogenital warts, which are also caused by HPV, and HPV immunization was not included because it was difficult to find Indigenous-specific research in these areas. So a first draft of this scan will be distributed to everyone who participated in the symposium in July, and they'll be asked to provide feedback and input, particularly with respect to studies that may have not been included in the first draft of the scan. Because we want it to be as comprehensive as possible, but didn't have all the time to research every last thing. And there's also papers that may not have made it into the peer-reviewed literature, and thus can be a little bit more difficult to find. So the results pertaining to cervical cancer show that the rates of this cancer are higher in First Nations, Métis, and Inuit populations in Canada compared to non-Aboriginal peers. However, cervical cancer rates are decreasing in both populations, in all populations in Canada, and they're decreasing at a similar pace, so there is a good news story to that.